So hi friends, welcome back to my channel Sims Nurses Corner. Today we are going to discuss about a mid-surge condition, that is meningitis, which is an important condition but simple condition only. So before going to topic, we have to discuss about meninges. Okay, what is meninges? Meninges is simply the outer layer of brain. Okay, the layer which is covering the brain, that is meninges. Okay, the meninges having three layers. Okay, three layers. See, from outer to inner, first one dura matter, second one arachnoid matter, and third one is pia matter. Okay, see this picture. This is scalp and this is cranium, and the outer one is dura matter. Okay, next one is arachnoid matter or arachnoid membrane. Third one is pia matter. Okay, in between the arachnoid membrane and the pia matter, there is subarachnoid space. This space. Okay, subarachnoid space, and in this space, CSF is found. Okay. So next you can see the definition. What is the definition of meningitis? Okay, meningitis is simply itis means inflammation. Okay, inflammation of the meninges. So it is covering brain and spinal cord. Okay, meningitis is defined as an inflammation of the meninges covering the brain and the spinal cord. Okay, so the inflammation is occurred due to the infection of the fluid covering brain and the spinal cord, that is CSF. Inflammation is due to the infection of CSF. Okay. Then it is a life-threatening disease, so it is considering as a medical emergency. Okay. Let's see what are the risk factors of meningitis. Okay. First one, age. That is under 5 years of age is more prone to get meningitis. Next one is immunosuppressive drugs. Use of immunosuppressive drugs for CA patient, then organ transplant patients are example. Then chronic malnutrition. Chronic malnutrition. Next one, AIDS. Then CSF shunt. Then chronic alcoholism. Then diabetes. Then pneumonia. These are coming under risk factors. Next, we can see the mode of transmission of meningitis. It is a droplet infection. Okay, it is spreading through respiratory and throat secretion. So, from coughing, sneezing, kissing, sharing eating utensils, water bottles usage, etc. Then some crowded settings also cause easy to spread. Okay, such as college dormitory, crowded places, military barracks, nightclubs, etc. Have a chance of meningitis. Then we can see the incubation period. What is incubation period? Normally incubation period is 2 to 10 days. Okay, 2 to 10 days or 3 to 4 days normally presenting, and it will last for 2 to 10 days also. The common cause of meningitis is Neisseria meningitidis. Okay, it is affects only humans. Neisseria meningitidis. Okay. Next, what are the etiological factors? First one is bacteria, then viral, then fungal, then parasitic or protozoal, then physical injuries, then cancer, then certain drugs, mainly NSAIDs, then head injuries, cerebral abscess, middle ear infections. Okay. So bacteria, viral, fungal, parasitic or protozoal, physical injury, cancer, certain drugs, head injury, cerebral abscess and middle ear infection. These are the etiological factors. Next, what are the bacterial agents which are causing meningitis? First one is Neisseria meningitidis. It is important one. Okay. Then Streptococcus pneumonia, Haemophilus influenza, HIB. Okay. Next, viral, which includes HSV, that is herpes simplex virus, then HIV, mumps, etc. Then fungal meningitis. Okay. Then next we can see the pathophysiology of meningitis. Okay, pathophysiology. What is the pathophysiology? First, bacteria enters in the bloodstream or trauma. Okay, bacteria enters. Once entered bacteria enters the mucosal surface or cavity. Okay, mucosal surface or cavity they enter and it break down the normal barriers. And once it breaks down the normal barriers and crosses the blood-brain barrier, BBB, blood-brain barrier, and it proliferate in the CSF. Okay. And inflammation of the meninges will be occur and increased ICP. As a result, increased ICP occur and further clinical manifestations shown. Okay. So next we move to the one important topic of the meningitis, that is clinical manifestation of meningitis. First one is, see, this is cardinal signs of meningitis. Okay, asking in April questions and we are getting confused with this Kernick sign and Brodensky sign. Okay, so see, what is first one is knuckle rigidity. What is knuckle rigidity? That is simply stiffness of head. Sorry, neck. That is when we moving the neck, patient exert more pain. That is knuckle rigidity. Next one is Kernick sign. Okay, what is Kernick sign? When patient is placed in supine position. Okay, and bending this leg like this, that is 90 degree to the hip. and the patient cannot retain the leg to normal position or exerting more pain. That is Kernick sign. Okay. Then Brudzinski sign. What is Brudzinski sign? When we are flexing the neck of the patient. Okay, in front position we are see patient is kept in the supine position and we are flexing the head of the neck of the patient and automatically the hip or legs also flexed. Okay, that is Brudzinski sign. It's important. Knuckle rigidity, Kernick sign and Brudzinski sign are the cardinal symptoms of meningitis which is used for diagnostic study also. Okay. Okay, next we can see other clinical manifestation. What are the clinical manifestation? First one, severe headache. It is important. Then irritability, restlessness, stiffness of neck, malaise, nausea and vomiting, high-grade fever, tachypnea, seizures, disorientation, tachycardia, coma. It's in complicated case, coma. Then sleeplessness. Then phonophobia. What is phonophobia? This one, fear of sounds. Then photophobia, fear of light. These two are important. Okay, phonophobia and photophobia. Then altered mental status or confusion. Okay. Then sometimes opisthotonus position also there because due to the increased pain, okay, or stiffness in the body, muscle spasm, the patient is like this, okay, head and toe will be in round and other body parts will be bent like this. That is opisthotonus position. Okay. Next one, what are the diagnostic findings? First one, by positive meningitis cardinal symptoms. Okay, Kernick sign, Brudzinski sign, and knuckle rigidity. Next one, physical examination, then history collection, then CSF evaluation or lumbar puncture. Okay, CSF evaluation for both biochemistry and hematology, then culture. Okay, for pressure, protein, glucose, and leukocytes. Okay, these are assessing in lumbar puncture. Then blood test, then CBC, then blood culture, MRI, CT. Okay. Next, we are going to discuss about important part of this topic, that is ESF findings in meningitis, asking in many exams. Okay. So first, I am discussing about a normal value. What are the normal values? Okay. So opening pressure, normal value is 5 to 20. Next, leukocyte, normal value less than 5, and cell differential normally 0. Then proteins, normally 15 to 45, and glucose, that is 45 to 85. It is important. Normal value is important. Normal CSF protein is 15 to 45. Normal glucose, CSF glucose is 45 to 85. Okay. And next we can see what are the changes in bacterial meningitis. Okay. First, opening pressure in bacterial meningitis will be elevated and the leukocyte will be greater than 200. Neutrophils is predominant in cell differentiation. Okay. And protein is high and glucose is low. It is important. Okay. The questions will ask when the patient is showing that the CSF glucose level is low and the protein is high. What type of meningitis we have to assess? It as a bacterial meningitis. So in bacterial meningitis there will be decreased glucose level. And in case of viral meningitis, this opening pressure is normal or slightly elevated and its leukocyte count is increased 25 to 2000. Okay, 25 to 2000, and protein is high and this glucose will be normal or low. Okay, low or normal. Okay, sometimes it will be normal. Okay, from that, not sometimes, all the time, majority of times it will be normal. Okay, from that we are assessing it is differentiating whether it is a no bacterial or viral meningitis. Okay, in case of cell differentiation, early it is a neutrophils is found and late time it is lymphocytes is found. Okay, this is bacterial and viral meningitis. Next is in cultures, in bacterial meningitis it will be shows positive and in viral meningitis it shows negative. Okay, and in case of fungal meningitis culture shows positive for fungal and in tuberculosis culture shows positive for AFP. Okay, acid bacilli. Okay, okay, these two are important. Bacterial and viral are important. And in case of tuberculosis, one thing you have to remember, that is in case of tuberculosis meningitis, tubercular meningitis, the CSF will be appearance as cobweb appearance. Cobweb appearance, it is important. Okay, cobweb appearance of CSF which shows tubercular meningitis. It is important. Okay. Next we can see what are the complications of meningitis. First one, hearing loss. Okay, hearing loss. Next, memory difficulty. Since it is affecting the brain, there will be mental related complications will be more. Okay, then memory difficulty, then learning disabilities, then brain damage, gait problems, seizures will be there, kidney failure, shock, and finally death. Okay, these are the complications. Next, management. Management is first early administration of antibiotics is first line management. Okay, usually penicillin is important. Penicillin, I will tell you later. Penicillin is drug of choice for that meningitis. Okay, to reduce the CSF infection, we are giving antibiotic. Then, and in case of viral meningitis, we have to give antiviral drugs. Then dexamethasone, that is corticosteroid, is administered 15 to 20 minutes before the first dose of antibiotic. Okay, and every 6 hours after for the next 4 days. That is 15 to 20 minutes first dose is given before first dose of antibiotic. Okay, and next every 6 hours for next 4 days. Okay, then antipyretics for symptomatic management, then dehydration treatment by IV fluids, and the seizures are controlled with the phenytoin, and some isolations is giving for me this meningitis patient, that is for first 48 hours after starting antibiotic, that is isolation. Okay, some multiple choice questions were asked, what is the isolation for meningitis, that is 48 hours after starting antibiotics, that is isolation need, that much only isolation need. So next treatment details. First, respiratory isolation for not for 24 hours but 48 hours. Okay, 48 hours after treatment of not chemo but antibiotic therapy. Okay, 48 hours. Then appropriate antibiotic should be started before, sorry, after doing LP. Okay, after doing LP, we can start antibiotic. If LP is delaying, we have to start antibiotic. Okay, then penicillin, ampicillin, chloramphenicol, and ceftriaxone. These are the drug of choice. Penicillin, benzyl penicillin, 1,200 microgram for adult and aged children above 10 years. Okay, then for 1 to 9 years, 600 milligram, and infant 300 milligram. Okay, this is penicillin. Next, what are the preventive measures? First one, hip vaccine, that is included in the pentavalent vaccine, hip vaccine in children we are giving. Then pneumococcal conjugate vaccine for routine childhood immunization. Then household members, that is family members, are we are giving preventive antibiotics to prevent the infection. Okay. Next, nursing management. What are the nursing management? First one, nursing assessment. Then obtain history of recent infections such as upper respiratory infection, exposure to causative agent, or exposure to any meningitis patient, etc. Then neurological status you have to assess, and vital signs you have to assess. Then evaluate the signs of meningeal irritations. Then assess sensorineural hearing loss or vision loss or cranial nerve damage, that is facial nerve palsy, etc. That is coming under neurological assessment. Next one, nursing diagnosis. What are the nursing diagnoses? First one is hyperthermia. Hyperthermia related to infection process and cerebral edema. Okay, infection process and cerebral edema. Next one, ineffective tissue perfusion, which is related to infectious process and cerebral edema. Then acute pain is important. Acute pain related to meningeal irritation and knuckle rigidity. Then impaired physical mobility related to prolonged bed rest. Risk for imbalanced fluid volume related to fever and decreased intake. Then risk for injury related to positive culture in CSF. Okay. Next, nursing interventions for reducing pain, administering antimicrobial agents and administering tepid sponging and antibiotics as well needed. Then institute other cooling measures such as hypothermia blanket, etc. Then next one, maintaining fluid balance, prevent IV fluid overload, which may worsen cerebral edema. Okay, and if having cerebral edema, we have to administer osmotic diuretics also such as mannitol. Okay, then monitor for intake and output closely, monitor CVP continuously, and enhance cerebral perfusion, assess level of conscious for the patients, and assess the signs of ICP. Okay, assess signs of ICP, and the quiet calm environment have to provide for the patient, and before prepare patient for lumbar puncture for CSF evaluation. Okay, whenever needed. Okay, okay, these are coming under nursing interventions. So till now we have discussed about meningitis, causes, etiology, risk factors, and clinical manifestation, diagnostic findings, and management. So hope you understood.